Doctor's consultation. At the doctor's section, you can see all these links: General Consultation, Obstetrics and Gynecology Consultation, Labor and Delivery, the Dental Consulting, Patient's Medical History, Ward Rounds, Lab Results, Attendance Reports, the Doctor's Tutorials, that's the videos for training the doctors, Patient's Details, Add Appointments, and Health Facilities Contact List. Now, let's do a general consulting as an example. So you can click on General Consulting, and this will take you to the page where the patients have been assigned to you as a doctor for that particular day. So, having clicked on General Consulting, I see all the patients that have been assigned to me. I click on the patient Lena Happy, and I can see the picture of the patient, the name of the patient is here, the age, and the payment method is by cash. That's what was selected at the records department. If she was paying by NHIS or any other insurance, we would see it here. These are the vitals that the nurses entered. Now at the top, you can see the different sections of the normal clerking sheet. That is the complaints, direct questions, drug history, past medical history, social history, examination findings. So for instance, I can click on examination findings and type my examination findings here. Now I can go to the investigations and just select the investigations that I want. For instance, once I click there and I start typing MPs, I can see MPs come up. That's for malaria parasites. I can add another investigation and another one and another one. If I type and it's not in the list, I can always click on the green button to add another investigation, another lab. That's if I'm authorized to do so. And I can delete investigations if I don't want them. So I've selected malaria and full blood count as the investigations I want to do. I can go to the diagnosis area and maybe select bronchitis as a diagnosis. That's the chosen diagnosis. So if I make a mistake, I can reverse both diagnoses back or select any of them. This is a test system, hence you can't see all the diagnoses here. But normally you have all the WHO diagnoses on the system when you are working at your hospital. So let me select malaria and bronchitis. And these diagnoses also have the ICD-10 codes. At the prescription area, I can prescribe drugs, and whilst I'm prescribing the drugs, I can see the stock levels. So I want to prescribe azithromycin. I want to do 1 tab daily for 3 days. And I leave it as active, and then I save. I can select a procedure. I can even detain a patient by clicking on detain patient, and I choose the number of hours I want the patient to be detained. Maybe detained for 3 hours, and I have to choose the date, so today's date. I can admit a patient. I can enter other notes for the nurses to look at. If a patient has a radiology report or any other report, I can take a picture of it and browse on my system and upload it and add it to the patient's file. You can upload up to 10 different files, that's pictures or PDFs, to the patient's folder. And then you can also book appointments for the patients you are consulting with. For instance, you've seen a patient and you would like to see the patient in 2 weeks. You can just enter the appointment date and then select the appointment time, and that's it. Once you save, the patient is also booked for that appointment. Whilst you are clerking the patient, you can also see the previous diagnosis for which the patient has been to hospital and the previous medications that they have also been prescribed with. And you can repeat such medications, especially for chronic disease patients. During the clerking, you can also look at that patient's past medical history by clicking on this button, and you can also look at the labs of the patient if you requested for some labs and the labs are ready. Then at the bottom here, you can also create your own medication templates and lab templates. There's a video entitled Prescriptions Made Easier, which explains how to make your medication templates and the lab templates so that you don't always have to type in the prescriptions.